Hi, I'm Kevin Pereau, the Digital Health Guy, and thanks for watching today's show. Hi, we're back at the HCEG Annual Summit, and joining me here today is Abner Mason, founder and CEO of ConsejoSano. Now, for those of you that don't speak Spanish, and especially for those of you who do, that's healthy advice in Spanish. Am I correct?
That's right. ConsejoSano is a patient engagement solution that focuses on reaching out to multicultural folks in the U.S., members and patients who, for cultural and linguistic reasons, really struggle to connect with healthcare.
That sounds like a Medicaid demographic. Am I right?
Absolutely. There's no question that the need is probably the greatest in the Medicaid market, but it also exists in the commercial market and the exchange market. It turns out that, that there are low-income people who work who still, for cultural, linguistic, and social determinant of health reasons, they also struggle to connect with care. But there's no question the need is greatest in the Medicaid population.
So how did texting become such a controversy for Medicaid, and especially in California? I know the regulators it feels like a lightning rod. Any thoughts?
We have a situation where the laws that govern text messaging were passed in 1992. So fast forward from 92 to now, where this is the common way that people communicate in America, especially low-income people. Text messaging, they're very comfortable with it. Everyone has either a smartphone or at least a mobile phone. And so this is the way people communicate. But the law was designed at a time when it was very new. And so it has put a sort of barrier in front of health plans who want to engage with their members via text message. So what we've got to do, particularly for low-income people, is say, number one, we need to prioritize their needs and how they want to communicate. That's first. So let's make that a priority. And then second, if we need to change policy so that we can meet these members where they are and communicate with them in the way that they're most comfortable, then we need to change the policy. And that's what needs to happen in the U.S. today. Fortunately, California is taking a step forward. Their Medicaid regulators have started to change policies, but that's one state out of 50. So what we want to do is to see if we can move very quickly to get the other states to follow California's lead and make it clear to manage Medicaid plans. You need to meet your members where they are, and that means that you've got to include all the forms of communication, especially text messaging.
Now, you have an event coming up that focuses on this very topic, right?
Exactly. So part of the goal of the conference we're hosting in Burbank, California on October 10th is to invite other Medicaid regulators from other states and plans from other states to come and to see what's happening in California, to see what the regulators in California have done, and to sort of jumpstart this process of getting other states to follow. We just can't allow the word to spread so slowly that it'll be years before other states follow. We think that by hosting this conference and gathering regulators from across the country and giving them the information, hopefully that will encourage them to take a step forward quickly and make it clear to manage Medicaid plans that engaging your members is a priority. And if you're going to do that effectively, you've got to connect with them the way they are and who they are and meet them where they are. And that means text messaging has to be included.
Boy, that's timely. I hope you can join Abner and his team next month, or October 10th in Burbank. One last question, Abner. You have such a mission-driven organization. I shamelessly will say that I take inspiration from both you and your organization's mission. How can the industry incumbents better connect with mission-driven like you? And do you have any examples of partnerships you can share?
I think that the key thing is to put the patient or the member first. And so using the text messaging example, if policies and regulations don't allow us to meet the needs of low-income people, then we need to change the policy. Amen. We just need to be clear about that. If you prioritize patients and members, it clarifies what we need to do. So that's the first thing. And then second, we need to find creative partnerships. So one example is Anthem. We're working with Anthem in California. Extraordinary example of Anthem wanting to improve their quality measures, wanting to reach their Medicaid members more effectively, and they wanted to do it quickly, and they were looking for a solution that could really connect with a Medicaid population that's very multicultural. California's Medicaid program is 81% multicultural, 14 different cultures and languages. The majority of people are Hispanic, but there are about 13 other cultures and languages. So Anthem wanted to move quickly to engage these folks, and so they partnered with us. But because it takes a long time to do a contract with the payer, the size of Anthem, it'll be a year before we could do a contract. Anthem was created. They said, why don't we partner with our provider groups? These are federally qualified health centers, FQHCs, the safety net providers in California, who do a lot of the Medicaid work. Anthem partnered with them and us, a three-way partnership. So Anthem already has a relationship with the FQHCs. These are their partners. We can do a contract with an FQHC very quickly. So that allows Anthem's new incentive program to work smoothly by they provide funding to the clinics, the FQHCs, and the FQHCs then pay us for our service. So it's a win-win for Anthem and for their clinic provider partners and for us. That's an example of saying we're not going to let policy get in the way or even the old ways of doing things, meaning you had to contract with the plan. We need to be creative and find creative solutions that allow us to move forward more quickly.
Well, good luck with your partnership. That sounds very exciting, and I hope you enjoyed the show today. Thank you for being on our panel. We had some great questions for you. Abner Mason, ConsejoSano. Thanks for watching today's show. Until the next time, to your health.